end-stage liver disease symptoms before death. Hi, it's Katie Duncan here with Death Care Coach, where we help you better navigate the end-of-life process. Getting a diagnosis of end-stage liver disease is serious news, and you might be wondering, well, what to expect? In this video, let's talk about end-stage liver disease symptoms and what to expect in terms of life expectancy. Before we do that, it can be really helpful to know a little bit more about the liver and what it actually does, because that way we can better understand what's going to happen when the liver isn't working like it is in end-stage liver disease or in cirrhosis. The liver is a vital organ with several different functions that are really essential for maintaining a person's overall health and well-being. The liver plays a major role in metabolism. It breaks down things like carbohydrates and fats and proteins, and it also stores glucose, or sugar, which is the body's main source of energy, and then it releases this energy when the body needs it. The liver also filters and detoxifies harmful substances from the body. This includes things like medications or drugs, alcohol, and other what we call metabolic waste products, basically toxic products that our body doesn't want, and it removes them from the bloodstream. The liver also produces bile, which is this greenish, yellowish fluid that helps in the digestion and absorption of fats. The liver makes different proteins. This includes things like albumin, which is really helpful for maintaining the proper amount of blood in our body and blood pressure. It also makes something called clotting factors, meaning it helps blood clot or stop bleeding when there's an injury. If we didn't have clotting factors, then anytime we started bleeding, we wouldn't stop bleeding. The liver also stores important nutrients like vitamins and minerals, and these reserves are then released into the bloodstream as needed to help maintain our optimal bodily function. The liver also plays a crucial role in the body's immune system by filtering and removing things like bacteria and viruses and other pathogens, or I think of them as bad guys, from the bloodstream. And it also produces immune factors and proteins that are involved in our immune response. The liver also regulates cholesterol, or the amount of good and bad fats we have in our bloodstream. So as we can see, the liver has so many crucial functions to maintaining our body's balance. What is end-stage liver disease? End-stage liver disease is when your liver is damaged beyond repair. It is often called cirrhosis, and it is significant and irreversible decline in the liver's ability to function. And it can be caused by several different conditions or diseases. What are some of those diseases and conditions that can lead to end-stage liver disease? They include things like chronic hepatitis B and C. These chronic infections like B and C viruses can lead to ongoing liver inflammation and scarring and ultimately end-stage liver disease. Alcoholic liver disease. Excessive alcohol consumption over many years can cause things like inflammation and scarring, and again, cirrhosis or again, scarring of the liver, eventually progressing to end-stage liver disease. Non-alcoholic fatty liver disease, or NAFLD, and non-alcoholic steatohepatitis, or NASH. These conditions involve basically the buildup of fat in the liver, and this leads to inflammation, it leads to liver cell damage, and eventually cirrhosis or scarring of the liver and end-stage liver disease. This is usually due to diet and obesity. Autoimmune hepatitis. This autoimmune condition causes the body's immune system to attack the liver. It leads to, again, inflammation, damage, and potentially cirrhosis and end-stage liver disease. Genetic liver diseases. Inherited conditions such as hemochromatosis. This is where iron builds up in the tissues, and Wilson's disease. This is where copper builds up in the tissues. These can both cause liver damage and progression to end-stage liver disease. The only curative treatment for a person with end-stage liver disease is a liver transplant. Unfortunately, not every person with cirrhosis or end-stage liver disease will be a candidate for a transplant or have a donor. When the liver stops working, as it does in end-stage liver disease, we are going to see the opposite of what the liver is supposed to do, as we talked about in the beginning of this video. Let's go ahead and talk about some of those symptoms that we might see when a person with end-stage liver disease is at the end of life. Number 1, jaundice. This is a yellowing of the skin and the whites of the eyes, and this is due to a buildup of something called bilirubin, which is a substance normally processed by the liver. Fluid retention, or basically the buildup of fluid in the body. This causes swelling all over the body. Particularly, we see swelling in the legs, but you might also notice it in the arms, in the face, in the scrotum. This fluid can also build up in the abdomen, and we call this ascites, and it causes discomfort, it can cause shortness of breath, and other complications. And we can also see fluid building up in the lungs, which can also cause someone to be short of breath. Problems with concentration, memory, and other mental changes. A complication of end-stage liver disease is something that we call hepatic encephalopathy. This is impaired brain function that is caused by the liver's inability to remove all of these different toxins. Specifically, we think about something called ammonia. And this buildup of ammonia can end up going to the brain, and the person can first look kind of forgetful and maybe just slightly disoriented. We can often see altered sleep-wake cycles. They're sleeping during the day, they're awake at night. And this can progress to ongoing and worsening confusion. They're lethargic. They may be combative, aggressive, agitated, anxious. We see this change in personality. And eventually, this will lead to coma and loss of consciousness and eventual death. Falls are also very common here. Easy bruising and bleeding. This is because the liver is now not making those clotting factors or those blood clotting proteins. And so this leads to easy bruising. We can see bleeding gums and nosebleeds, and in severe cases, we may also see internal bleeding. Gastric and esophageal varices. Esophageal varices are basically these enlarged and swollen veins. They're very fragile and thin veins, and we see them in the lower part of the esophagus. That is the tube that connects the throat to the stomach. And we can also see these varices form around the stomach as well. These varices develop when blood flow to the liver is blocked. And these varices, esophageal and stomach or gastric varices, are concerning because they can rupture, they burst, and they can cause life-threatening bleeding. When a person is on hospice, treatment for these varices is really aimed at trying to prevent bleeding and manage any complications if they do burst or rupture. Hospice will often recommend having something like a black or dark towels or dark clothes at the bedside to lessen and mask the appearance of blood, and to call hospice ASAP if this does happen. Fatigue and weakness. When the liver stops functioning, we are going to see that the person just doesn't feel good. They don't have the kind of strength they used to have or the energy they used to have. We see a loss of appetite and weight loss, and all of this is really generally due to the buildup of these different waste products and fluid in the body and specifically in the digestive tract. And we can see this lead to things like nausea and vomiting as well. Itchy skin, which you also might hear called pruritus. This is because of something called bile salts that build up in the bloodstream and underneath of the skin, and it causes this itchiness. And the most intense itching is often felt in the late evening. This itching often affects the limbs, so the hands, the feet, or the soles of the feet and the palms of the hands, but some people may report just generalized itching. When a person is on hospice care or palliative care, the goal will be to manage these symptoms as best as possible, to keep that person as comfortable as possible, and to support the family and caregivers. There are several different medications or other techniques that a healthcare provider might recommend, especially for things like that fluid buildup, that swelling, and that mental confusion. As we mentioned earlier, typically the person with end stage liver disease will experience changes mentally. They're confused and even agitated, and eventually they will become unconscious and unresponsive. And typically this occurs hours to days before death, again, because of all these toxins building up in their body. Specifically, I think about ammonia. Let's talk about life expectancy. When a person has been given a diagnosis of end stage liver disease and has been experiencing any or all of these symptoms, the median survival is about 2 years or less without a transplant. Healthcare providers will be looking for how many symptoms a person is experiencing, different types of blood work that also help to determine how well or how poor the liver is functioning, and any major complications that may have occurred because of the person's liver disease. And they'll use this information to determine if a person is ready for hospice and likely has 6 months or less to live. If you are noticing most or all of these symptoms and the person with liver disease is not on palliative care or hospice, ask the healthcare provider to have an honest conversation about how their disease is expected to look in the near future. It's important to use this as an opportunity to figure out what's most important to you or what's most important to your loved one, and take some control in how you want to spend the rest of whatever time is left, no matter how long that may be. What do you hope for? How do you want to feel? Who do you want to spend your time with? What are your top 3 priorities? If you found this video helpful, I would love it if you could hit that like and subscribe button below. This helps people who are going through this journey find this information. Thanks so much, and be sure to check out my other videos on end-of-life care on our channel, Death Care Coach.